Hello, and welcome to Community Voices, where we talk to Humboldt County's movers and shakers. Today's guest, Dr. Ruby Bayan, Executive Director, Waterfront Recovery Services. And now here's your host, Paul Bressoud.
Hello and welcome to Access Humboldt's Community Voices. I'm your host, Paul Bressoud, and I'm here today with Dr. Bayan, both the medical and the executive director of the Waterfront Recovery Project. So welcome to the show.
Thank you.
I was intrigued by your website when I visited, and first off, the statement that treating addiction by treating the whole person. What do you mean by that?
That's right. It's not uncommon to have people with substance use disorder to have comorbidities like mental health problems and also physical problems. And it's like a whole car. If you don't treat one, the car won't run as well as we wanted it to. So what we offer is not only a treatment for addiction, but also treatment for any medical problems as long as it does not need higher level of care like the hospital. And we also treat mental health as long as it's not the primary diagnosis. Mental health that is likely going to need treatment at SV is not appropriate for us, but we are able to evaluate the patients and stabilize them while they're doing their addiction. And our addiction treatment is under medical model. And we are the only medical model addiction treatment in this part of Northern California.
Well, let's go back and talk about some of those things. How do you deal with medical issues and mental health issues on your site of Waterfront Recovery?
Well, the good thing is because we're a medical model, we have doctors and providers who can provide both psychiatric and medical problems. Like a patient may have an alcohol problem, we detox them, but at the same time, we treat whatever other comorbidities like liver problems. You know, we try to evaluate if there are other medical problems like hepatitis. We during the detox process for any of the substances, if the patient has other mental health problems such as bipolar, even schizophrenia, we treat them at the same time that we're treating the addiction.
Does that take longer to go through the process because you're treating medical and mental health issues as well as the addiction problems?
Well, not really. Again, we have two programs. The detox, wherein when the patient comes in withdrawal, we stabilize them. And if there is a need for medical or psychiatric medication during that time, we do it the same time that we were detoxing. However, after that, we have another program, which is the residential treatment program. And that is like a 30, 60, 90-day program where this is where they learn coping with addiction and learning new tools and healthy living. And at the same time, we are treating their medical problems. We make sure that their diabetes is under control. If they have a simple urinary tract infection, bronchitis, we treat that while they are in treatment.
Does that make it easier to streamline the health process, or does it complicate matters to have, to treat the addiction and the comorbidities?
Well, sometimes it's not that simple because we have to make sure that, we use the appropriate medications that can treat like both mental health and addiction. And there are common medications that we can use. For medical problems too, there are some common medical medications that is helpful for addiction, at the same time helpful for their medical problems.
Do you find the success rate greater because you're treating the whole person?
As a matter of fact, I'm very proud to say, and we have our numbers through Cal State, through Humboldt, HSU, which is now Cal Poly, but we have at least 60% success rate, which is pretty good for a residential and detox program.
Wow, congratulations on that. Now, you said it was the first detox program that's been certified in Northern California. So my question is, why is that? Is it because it's a controversial way to go about things? Is it a different way to go about things? Is it new way of treating people?
Well, it's not controversial. It's just that to be able to put this program together, John McManus and I had to jump through many hoops, government hoops, licensing. We're licensed 3 times more than any other regular program. And to be able to have a doctor and another nurse practitioner to be at the facility and to be able to treat them with medication to detox. So it doesn't really complicate things. It makes things easier because, again, if you're detoxing a person and the blood pressure is out of control, we're not going to be able to do that. We're not going to be able to successfully detox a person when the blood pressure is out of control. So medically, we have to treat the blood pressure to be able to go through a successful detox.
So the detox program, because it's a medical detox program, is it different than others that we've heard about in the state?
Absolutely. The most common detox program is the social model detox, wherein basically the patient is sent to the detox without any medical personnel in the facility. They may supervise the medication, but not really having the full benefit of medical personnel, which makes it sometimes very complicated and sometimes dangerous.
For the people that don't have the medical facility?
Yes, yeah.
Or the medical staff with them. I'm sitting here and I'm thinking, why don't all facilities have doctors on site and have the medical detox?
Because as I've said, one has to jump a lot of hoops. It took us about 2 years, to get all the licensing to be able to build this medical model detox.
Well, let's go back then. So before that, did you work in a facility before that was a medical detox?
Oh, yes. I've been an addiction psychiatrist for over 30 years now, and built medical detox at Kaiser Permanente and in different hospitals. So I knew that this would work. My passion in doing this here in Eureka is because we want to serve the most indigent and those people who are not able to afford private institution with the same kind of service that these private institutions are providing their patients.
It's interesting to me that you talk about the needs of a community. And you just made that statement where, a lot of these facilities are priced out of people who need them range.
Absolutely.
When you talk about the needs of the community, are you talking about, the country as a community, or are you talking about specifically a place like Eureka as a community?
Oh, I really think, small communities like ours, I consider as the nuclear of the society. Mm-hmm. If we are able to promote this kind of treatment dealing with the whole person instead of just a part of that person, whether medical or psychiatric or addiction, I really think that the success is going to be a lot higher.
Are there a lot of examples around the country of communities this size that have medical detox treatment centers?
The other medical detox place that I know of is in Southern California, which I was originally from Southern California, and there is a medical detox there, which is also drug medical certified like us. We're the first drug medical certified medical detox, and there's one in Southern California, and it's also a for-profit and not-for-profit organization. Waterfront is under ADCS, which is a nonprofit organization.
So, if the success rate is so great, I keep coming back to that. I'm dumbfounded by the idea that the licensing is so difficult that people can't see the value of going ahead and having medical treatment facilities and treating the whole person. With your success here, is that something that you try to do, reach out and encourage people to go this route and encourage people to hang in there through the situation of the licensing and whatnot?
Oh, absolutely. For this to be able to be shared to other people, to other counties and other outside of the state, we have to do a study, which we have all the numbers, and present it to the scientific medical community, and say how it actually is successful.
Have people stood up and started taking notice to you? Are people coming to you and saying they want to find out what is behind your success?
Well, as a matter of fact, yes. And the other thing, too, is we also serve 6 other counties outside of Humboldt.
Really?
And they send us, their problematic patients who otherwise will not get the psychiatric or the medical problems while having the addiction problem.
So you must have pretty significant residential space at your...
Well, no. No. And that's why, with the kind of with this kind of program, we have to start small. So we have a 56-bed at our facility, which used to be the old Max Center. Mm-hmm. And there are 36 beds for residential, both for men and women, and 20 beds for medical detox.
And then you have an outpatient program as well.
No, we don't.
You don't have an outpatient.
However, the other thing, too, that I really feel, and I'm very passionate that I hope other facilities will take this, too, is while they're at the waterfront, most of them are homeless when they come. But we are able, I would say 75%, we're able to find them a place, a transitional program when they leave our program because of case management.
When you manage cases after someone has left, how involved is Waterfront with the transitional program from somebody leaving the facility to entering back into everyday life?
Waterfront has about 4 transitional programs. We follow them over there, and if they're not in our facility, our case managers would follow them up and check on them. We also have what we call an alumni group, where all the alumni are able to come on Monday night to check on them and check on us.
Right on. And then you also run other programs, right? I mean, you have group therapy. And,
Yeah.
What is the matrix system? I wrote that.
Well, it's basically things that one would need to know about addiction and how to deal with addiction, including dealing with stress, dealing with cravings, and all of that. It's just a way of educating them on how to have a healthier lifestyle.
Speaking of a healthier lifestyle, as I went through your website, I saw the presentation, was very impressed with the kitchen. Can you tell me about the kitchen?
Oh, yes. John McManus, who is the co-founder, we made sure that we need to feed not just the soul, but also the body. And the kitchen is actually one of our highest budget, because we'd like to make sure that we serve them wholesome, not out of the can, and appropriate food to get them be healthy again. They come in almost emaciated, and by the time their complaint when they leave is that they've gained too much weight. But we also have a garden, and which we fully make use of, especially during the summer, and we gather our vegetables and our spices from this garden, which are also managed by the residents.
The residents work in the garden, but you have a special kitchen staff that,
Oh, yes.
that just does the cooking. So
Yes.
It's laid out for them. And I believe Jesse, who's your cook.
Oh, absolutely.
He was in my first class at Eureka High when I first started out, so I'll have to connect with him. I saw him on
He's a wonderful chef.
Well, it looked like a great scene. So my question is, are meals communal? Are there times? Is that a place where people can get together and connect?
For detox, during the detox, we bring them their food. However, once they're done with the active withdrawal, they join the residents in our dining room. So it's a communal thing. And we also make special meals for those who are allergic to specific things, vegetarians, and other preferences.
Other special meals you make, and it's something I was very impressed with when I was checking out the website. You go to great lengths to celebrate the holidays and birthdays and whatnot, and there's a great reason behind that. Can you explain the holiday celebration mode you go into?
Well, again, most of our folks, are from difficult situations that, they may have not celebrated holidays. Some of them don't have any families. You come to Waterfront family, we'll celebrate it like a family. And if it's your birthday, we'll sing happy birthday with your cake and ice cream. So, again, we're very passionate about making sure that we treat our folks the way how we'd like to have our families be treated.
I also was very impressed when they were talking about modeling the behavior of celebrating an event, a personal event, or a holiday, which can be stressful times for folks,
right,
too, without drugs or alcohol.
That's right.
And showing that it can be done.
Absolutely. You're absolutely correct.
Can you tell me about the ADCS Housing Rehab Project?
Well, we have 3 houses for men and 1 house on J Street for women. And these are transitional houses. These are, again, who are graduates from our usually residential, and most of them don't have a place to stay, or the home where they're going to go to is not healthy for their recovery. So we let them go to our houses, and as long as they're either looking for a job or they're going to school. And you know, they're self-sufficient. You know, we have them managing the place. And yeah.
So as they transition out and they apply for this housing and they have to go ahead and show these other aspects that they're moving on in their recovery?
Yes, but even before they get to the house, while they are at residential, we're teaching them how to do resume. We're teaching them about enrolling in schools, like at CR. So hopefully, by the time they leave, they have those armamentarium to really make use to find a job or to go to school.
Now, how long you were talking about Humboldt State having your numbers. How long have you been open?
We've been open for 4 years. We just celebrated our 4th anniversary.
So if indeed you have 30 and 60 and 90-day treatment programs, how many people you think go through Waterfront a year?
Oh, my goodness. This was just, I know that for the 4 years, I think we have close to 3,000.
3,000?
Yes.
My goodness. And then how many people have wound up in the transition housing as they've left the Waterfront?
Well, you know, I wish we could have enough houses to put our graduates from our residential, from our detox. But we only have 3 houses for men, and again, just 1 house for women. And I believe there are about 8 in the women's house, and probably about 20, 25 in the men's house.
Right. So of that, at any one time, maybe, I don't know, I mean, the math in my head, so maybe a third of your students wind up going through your transition housing, and you said you have a 60% success rate at the time. 60% sounds fantastic compared to traditional programs or programs that are not medical detox programs. Is 60% a number that is not just representative, but is in the upper percentages?
Absolutely. And I really think it has to do with the holistic treatment.
The holistic treatment is the key.
Yes.
So when you intake someone, the holistic treatment, you have specifics that the Waterfront does, as far as, you know, how you put them up and how and treat them medically at the same time and have the good food. What about the patient's history? I mean, that's got to play into it as well.
Well, when they are evaluated, when they are first evaluated when they call, and we have an evaluation, extensive evaluation by the phone, through the phone. And we asked about their history, their medical problems, their mental health problems, their housing, legal problems, and other socioeconomic problems, CWS. We have a lot of CWS folks coming through. We also have people from the jail who come through. So we get all that information so that by the time they come to us, you know, we know a lot about them. If they have mental health or medical problems, we get their medical records. And no recovery center would do that.
Right.
We get their medical records and we evaluate. So we know more than what the patient is telling us. We know more than what the agency are telling us about this patient, because sometimes they forget to tell us. And so then when they come, we know exactly how to treat them.
Yes or no question. Do you have more applicants than you currently have spots for?
especially more recently.
Oh, as the pandemic is sort of
Yes.
easing up a bit.
Oh, yes.
Oh, we're going to have you back. That's a
Yes.
whole nother topic that would be fascinating to find out. Boy, I just don't understand why they're not all like this, but thank you for giving us a tip of the iceberg here, a brief look into waterfront recovery. I'd like to thank my guest, Dr. Bayan, for coming down, and we will need to talk to you again. I don't think there's any doubt about it. It's fascinating to hear about. Say hello to Jesse.
I will.
Tell
I
Paul
will.
Bressoud says hi. I want to thank you all for being here on Access Humboldt Community Voices, and for Paul Bressoud, take care.
This has been Community Voices with your host, Paul Bressoud. If you represent a nonprofit organization and are interested in being a guest on Community Voices, send an email to info@accesshumboldt.net or call 476-1798. Access Humboldt, local voices through community media.